Good afternoon. You are tuned into Ability Matters, a program that covers matters to do with abilities, disabilities, and everything in between. Ability Matters is one of the longest-running disability-related programs in the whole wide world. Starting its headway on air in 2007, you can now listen to podcasts of previous Ability Matters programs on YouTube and Spotify. Just search for Ability Matters. Ability Matters is brought to you by My Home Living Care, an NDIS registered disability.
Yes, thank you all for tuning in, listeners. Good afternoon. Okay, so let's jump straight into it, shall we? I'm your host, Tony Scott-Emilio, and with me, as per usual, my co-host on the other side of the desk. Got to slow down. I'm talking too fast. Bit too excited now. Okay. On the other side of the desk, we have my co-host, Bec from Flagstaff. How are you, Bec?
Good. How are you today, Tony?
I'm using my more presenter voice, I think. Yeah.
The radio voice.
My radio voice.
It's a little bit smooth.
It's more pretend, I suppose, but no.
Doesn't matter.
So who do we have with us today?
We have Maddy in the studio with us today. Thank you for saying yeah, I've got that too. Thank you for coming in and talking to us today, Maddy.
You are very welcome. I was very pleased to hear from you.
No, I'm more than happy to have a little discussion. You're a strong advocate for the changes of the NDIS, I think.
Yes. Those were very concerning when I heard about them when they were announced, and it just felt kind of a little unfair, really, because I heard about these changes and all I could see from everybody in the disability community was just more worry, more stress, and just uncertainty.
Yeah, and I just want to let people know out there listening, so I hope that's okay with you, Maddy.
Oh, yeah.
Just to let everyone out there know, Maddy is actually in a wheelchair, so she probably has a lot more concern about changes to the NDIS than most.
Yes, it's really tough for me as somebody who is visibly disabled to hear stories about people who have invisible disabilities or other disabilities you can't quite recognize and trying to get on the NDIS, and you know they're sick. You can see them every day, but still it won't be recognized by the powers that be, which is very unfortunate.
I believe you're talking about someone like myself with a brain injury, known as the hidden disability, because you can't see it with the naked eye.
No, absolutely not. Yeah. And that's what I've noticed a lot. These cuts that are coming, it seems to be primarily towards people with invisible disabilities. And I've been told by many people, some who are in the NDIS as a field work, that I would be safe from these things. But quite frankly, that's not why I'm speaking out. I'm speaking out because I know that there are people who cannot speak for themselves or cannot bring themselves to speak for themselves because they know if they ask for more, the NDIS is more likely to challenge them on that. And that can take a mental toll, that can take time, that can take even money, which if you are disabled, hate to break it to you, you don't have a lot of money.
No.
That's why these things like the NDIS were initially set up. And while, of course there are orders and things like that on the NDIS, but it's also for basically any government program. And the numbers I've been seeing don't match up to what I've been researching. There's about 70,000 roughly on the NDIS currently, according to a study that was done last year. And in 2024, I believe, there were about 5.5 million Australians with a disability. So the numbers really don't add up if people just think, oh, they're only catering to the disabled people. No, it's very hard to actually get on the NDIS. Like I said, you have to come in and see, prove to people that you are disabled as you know you are.
Yeah.
It's very true that you can say that, Maddy, because I've had a stroke and I don't qualify because I'm not in a bad enough condition I can drive my own car. So apparently they go off how much you can do for yourself. So
yeah. And that's the thing. They don't consider those nuances because at the end of the day, even though I love the NDIS and love the opportunities it's given me and everything it's done for me so far. The people that they have working there sometimes do not understand disability, the nature of it. Like, it's different for everybody. You can have this two people with the same disability, and it will be very different for everybody. Like, I have cerebral palsy, and some people with cerebral palsy can walk. I cannot.
Yes. That would indicate Emily that we just had on last week.
Yes.
Emily actually has cerebral palsy as well.
Able-bodied person with cerebral palsy. Yes. Bit of a tongue twister.
Yeah, that's so true, because there's so many different factors, and a lot of them can even just be personality.
Yeah.
And how people are equipped to handle different challenges. So I think it's very brave that you're speaking out and telling
Incredibly.
people what they need to be aware of.
Yeah, it's how the NDIS has always been, to a lesser extent, but these cuts are going to make it harder, and it's going to take more time, more reports, which I think they even admitted it on TV that they don't even read. So you're spending like $1,000 on reports,
Paperwork,
by professionals, by people who are trained in these fields to vouch for you and say, yes, your disability is valid, and they just skim the reports you give them, because there's just not enough knowledge behind the people making the decision.
The claims, yes.
Yeah.
They
Yeah.
just look for key hot terms, I suppose. Yeah.
Maybe we
Key
need
terms,
to
yeah.
bold certain parts of the report, put it in bold writing, so they
Yeah.
know
This is
that's
the point.
important.
I literally had to do that with my last ART. I literally had to highlight and bolden everything that was worth mentioning, because I knew they were going to go, well, you didn't mention this, and I'm like, it's in the report. On this page, on this paragraph, bold, highlighted,
So,
everything.
yeah, they're not taking the time to go
The key
through the
points,
whole
yeah.
thing and make sure.
Yeah, and that's one of the changes, like, I feel like that needs to be done. You need to get professionals in this field, and not like the top billed professionals. You can get OTs, or like you can get counselors to understand mental health disabilities. You can get like, not necessarily physiotherapists, but you can get like physiologists who understand how the body works.
Oh, exercise physiologists
Yeah.
that help you work out what you need for
They
your
need-
mobility
Rehab.
and stuff.
Yeah, they need actual professionals in this job. And I understand getting professionals is expensive, but in the long run, it's going to save you more money, because if that is truly your concern, that fraudsters are rorting the system, then that can eliminate that from happening.
Yeah, and get it right the first time
Yeah.
and have it all set up properly, and then it will flow from there, and it
Yeah.
will be much better. No worries. I wanted to ask you a question, if that's okay, Maddy. What made you actually want to advocate for people on the NDIS? Because I know you've got certain situations yourself, but what made you think, well, what about everyone else?
I've spent my time in group homes with everybody with mild disabilities to very severe disabilities, and it kind of opened my eyes to the fact that there are a lot of people who kind of are left in the dust by certain branches because they cannot speak for themselves, or they do not have the time to speak for themselves, or their carers are burnt out and afraid of the system. So, and I know myself, as somebody who's gone up against the NDIS multiple times for very simple things, and I've won most of those cases against those people. I just thought, if somebody needs to do something, it should be me, because I've gone up against the NDIS.
You know what
Yeah.
you're talking about.
Yeah.
Well, no, that's wonderful, and I commend you for doing that, because a lot of people wouldn't speak up, especially for other people. So you're doing a great job.
Thank you.
I think it's about time we interject with a bit of a song here. I've got some James Brown lined up with I Got You, I Feel Good from 1964 album, Out of Sight. Wow! Yeah.
I feel good.
Okay, we're just going to jump straight back into it now. The interview between Bec from Flagstaff and Maddy.
Hello.
Yeah. Where did you come from?
Maddy's not from anywhere.
not
She's
from-
an advocate.
Oh, lived
Appeared in the
experience.
studio.
Yeah.
She's
of
just
course, yeah.
appeared. Yeah.
Yeah, just magical. Yes. Okay. Yeah.
So I'm just curious. What is involved for people to get a plan and find the right provider? I know that you say it's a little bit different. So what is your take on it?
My take is, look, I'm going to be completely honest. It's a minefield out there.
Of course.
It's very difficult to find the right provider. You need a lot of like energy and stuff to do that, which again, most disabled people do not have. You need not only like the right people behind you, but you also need to make sure that they are not overcharging you, which again is very hard to spot because everybody's out there trying to make money off the NDIS. Like, it's just a complete, you have to go in blind with basically total faith that you pick the right one. It's not a guaranteed thing. I've had a couple of bad supports. I'm sure everybody has had a couple of bad supports. But when it comes to like doing a plan and getting the right provider, it is exhausting because you have to like just basically understand how the NDIS speaks, what their language is, and you have to cater to that, which is very difficult to do when you don't know what you're doing and they don't prepare you for that.
So I suppose it would be, I suppose that would be when you need to sit down with them and actually say, well, what, can you tell me what this is about? Can you talk to me about this? And get a bit more of an idea of all the different things you might need to know.
And look, I've heard horror stories about, because this happened to me multiple times, where the NDIS can literally just decide what your plan is without you being there.
Oh, wow.
Yeah.
And what is that, just based off the medical information that you provide? Or?
I honestly have no idea because
Words on paper.
I remember like
the reports.
a year late, last year, my supports got cut and I didn't find out about it until my plan manager at the time called me and said, why didn't you tell me you had a new plan? And I went, what? And then I actually looked at my new plan and my plan was basically gutted from what it was.
Wow. And
Yeah.
so...
And I was already on so little.
So
I couldn't afford another cut.
And so is that like maybe from somewhere down in an office somewhere or something, someone actually automatically does all that?
I can't say for certain, but it just feels like they skim through a bunch of reports and they go, okay, what can we cut? It's not necessarily catered to what the person needs. It's more of money first, person last. Yeah. And I hate saying that about the NDIS because there are a lot of, good people who work for it. And that's not everybody, unfortunately. And these cuts that have been announced, this is not good for anybody. Like, I cannot tell you just the amount of chaos this will cause.
I agree 100% because I know something very similar to that, but I know how it works because they just go through and they see what the weakest link, so to speak, is that they can just cut from the system and save some dollars sort of thing to make it look like they're doing the right thing on paper.
Yep.
They're taking advantage of the middleman,
Yep.
which is you at the moment, I'm sorry. Yeah.
And it's mostly for things like social and community participation, I find, that get targeted the most. And people like to paint community participation and socials as just like a thing for them to, go to the movies or have haircuts or whatever. But it's more than that. To me, it's more integrating yourself with society, having opportunities and getting jobs and doing that sort of stuff that everybody keeps pressuring you to do, but you can't do on your own, right?
Yes, I totally agree. I feel like there's a bit of a big gap there between what they want you to do and what you're able to do on your own, and they don't seem to want to find that
so they can't
person that can help you with that gap and close it down.
They can't bridge the gap, that's right. But I think it's time we just get back to some more tunes to break up this information. Yes, that was just Bill Withers with Just the Two of Us from the 1980 album Wine Light. Also, the song featured Grover Washington Jr.
And that was actually also in Austin Powers.
Oh,
And he sings about Mini-Me.
Yes,
Heck yeah, man. Heck yeah.
but
That's a good song.
he covered that song. It was actually, this was the original. This is the song he covered for Austin Powers. I looked into it.
Okay.
Did a bit of, quick
Music man knowledge.
insight research. Yeah, there you go.
All right.
Trivial, but there you go.
No worries. So, Maddy, everything you've been saying is great so far, and it's so awesome to hear someone that's actually experiencing it and going through it, that knows the challenges that you may have to face. But I'm just curious, are there some important things about these changes that people that are on the NDIS, their carers, support workers, or even organisations or those in the community might need to know?
Okay, so I think what a lot of able-bodied people don't understand is if these cuts do go through, a lot of people that were kicked off the NDIS will start going to private health insurers and things like that. And that will start to clog up that system even more.
So it'll have like a flow-on effect.
And of course, private is always more expensive too.
So that's the main problem that I don't think a lot of able-bodied people understand, is that it will affect you. It will make things like, private health insurance get a lot harder for you as well. This isn't just, a disability community problem. This is an everybody else problem. And the thing is, although providers are great to have, they do overcharge a lot of people simply because
they can.
It's a loose system with no clear definitions of what they can charge, right?
So there's not really a guideline system that says...
I mean, I suppose there is in theory, but if you say to somebody, hey, you can basically charge whatever because it's the NDIS, they're going to choose the maximum every time.
Of course, because they believe they can get away with it.
Yeah.
Until now, it's not even... I've only just... Every year... Sorry, I'm just bugging now.
All right.
Every year I've been on this NDIS thing, and it's always on TV at night time, in the local news. Oh, someone else is roaring the NDIS, and every night someone different.
And I can't help but feel that that's deliberate to make society as a larger whole feel okay with these cuts happening, because they're painting it out to be, we're getting rid of the fraudsters.
Unnecessary thing.
And unnecessary people. I'm like, okay, so what is your definition of a mild disability? And there really isn't a definition of mild disability, because you don't know this person's personal experience every day. They could be fine one day, and they could be worse the next. Chronic illness is a thing. Schizophrenia is a thing. Depression is a thing. Right?
Yes.
It all fluctuates.
Anxiety as well.
Yeah, it all fluctuates, and that's what is, I believe, inherently wrong with the NDIS even now. But these cuts are just going to make it even harder, which, as I said, leads back to a lot of people trying to find alternative means for their care, which means it's going to plug up a lot of systems, or at least clog them, with other people who've been kicked off from the NDIS looking for care that way. And it's going to make it a lot harder for the rest of you to find providers for private health insurance.
Yes.
That was beautiful. I mean, this is... I've known about all this stuff myself, but reading it from a little bit of personal experience, but majority of it is just things you read in the paper and on paper, that sort of thing, but now hearing it again, very similar words, but the way you're saying it is so emotional. It's beautiful.
Yeah, it's...
I'm sorry you can only hear that, listeners.
It's an emotional issue to me. And the NDIS was founded on emotion, right? When Julia Gillard announced it into Parliament, she almost burst into tears, right? And that's what, people have forgotten. That these are people too, and they might not think the same or talk the same or do the same things that you do. But inherently, they are still people, right? And I don't know if, I speak for everybody, but if I was paying taxes, I would be glad knowing that my taxes was spent on somebody living
helping
their
someone,
life.
Yeah. No, it's the one thing I actually mentioned a fair bit with my other stuff I do, altered abilities. But to me, it's like looking at a, it could be any kind of fence you want to imagine. One day you're on this side of the fence, everything's rosy.
Yep.
It's for able people,
Yep.
able-bodied people. The next day, you're not
Even the smallest thing
able-bodied,
can happen.
and there's so many changes that have been made to your life that you actually go, well, hang on a minute. Oh, that really is not fair.
Yeah.
And it's like, it's a bit late once you're already on that side of the fence, but having that openness and awareness to people of what they might be going through
But
and
still,
things
just
that
sorry.
might be different for them that they need to be aware of.
So yeah, before earlier when you mentioned how Julia Gillard was the person who spearheaded the whole NDIS thing, however many years ago it was, that was fine. It was a beautiful dream, but she never intended it to be, or never foreseen it to be exploited the way it is these days.
Yes.
I'm not saying it's her fault either. I'm just,
No.
yeah.
I truly believe that when she announced it into Parliament,
She had the grandest
It was.
themes, yes.
She intended to do parameters and do this properly. However, with how it was set up later on, it was very easy exploitative. And I'm not, denying that. No one is denying that. But what we're asking is, why can't you help us without hurting us? Why do you have to kneecap us in order to save another thing,
Yeah,
That is a powerful
yeah.
way to put it. Kneecap us. Wow.
Yeah, oh, pretty
Lovely.
much, yeah. I think that what you're saying is perfectly spot on, because everybody is going to need some sort of help at some stage in life, some more than others.
Yes.
And I think that having that awareness and compassion in ourselves before anything does happen is going to make it a hell of a lot easier to understand that if and when it does happen to us.
Yes. And I want people to remember who don't understand the disability side of it. If they can do this to us and make a majority of the public okay with it, they will do it to you.
Yeah,
It will take some time.
Yeah, I don't think they get it. It's not
but
just
if it's successful in
one
one area,
group.
they're going to attempt to do it in others.
Yeah.
They might not be successful in other areas, but they will still try to.
They're going to give it a go. Yeah, totally. I understand that exactly what you're saying. I think that everyone needs to have the radars on for everything.
Indeed.
Are we
Alright,
going to flick to a song now, Tony?
Well, let's. I've got some Kiss lined up with the song "Beth" from the album Destroyer from 1976. Actually, the vocals are by the drummer this time, not Paul Stanley, the original singer that everyone knows Kiss for. The drummer's doing the vocals, and he co-wrote the song too, with Stan Pepperidge and Bob Aaron and other people. Yes, but here we go. Kiss is a beautiful ballad. Let's have a listen, shall we?
Now back to your favorites.
Vox FM 106.9.
Yes, that was just Kiss with the song Beth, album Destroyer, 1976. Vocals by the drummer Peter Criss, who co-wrote the song, not with Stan Pepperidge and other people, and Bob Ederman. So yes, that's not really trivial. It's really pretty trivial, but yeah. Yes, this is still Ability Matters on your community's greatest radio station, sorry. 106.9 Vox FM. Now let's get back
I'd
over
be
to...
a bit whoa if it was on video.
Oh, yeah.
I don't want people to watch me all the time.
So let's get back over the other side of the desk with Bec from Flagstaff and Maddy.
Hello.
No, you're doing a wonderful job, Maddy, and we were just briefly chatting about in the section where the music was playing about the fact that the numbers are only going to increase and they're not going to go down, I don't think, anytime soon. You've got people that have lifelong
Disabilities, people
Yeah.
who get in accidents,
Yeah.
people who are, born with this sort of thing. And that's just, that's the main thing that worries me is these cuts, they're temporary Band-Aids for a much bigger problem.
Band-Aid
Yeah.
solution. I've heard
It's
that
about
before, yes.
having someone sit down and go, all right, well, this is only going to get worse. It's probably not going to get better anytime soon. So we need to work out a way where we can actually, because we've decided as a society, I think, we're going to help people and look after people that need some assistance. And rightly so, I think we should. Because we all know that anyone that needs it at some time is happy to have assistance when it comes up. So I think helping people is a proper big thing for us. So do you think that there's like a message you would like to share with the listeners about things that they should maybe be aware of? Or
I think I covered most of everything I wanted to say. Perhaps not as elegantly as I wanted, but I just want...
You did fine.
I just want people to know that, you know, this is life we're talking about. These are the simple things.
Exactly.
Getting up in the morning, getting dressed, having a shower, going to the bathroom.
Everyday things that everyone else might just take for granted.
Yeah, and like... If a person wants to go out to a park or have a coffee, they should be allowed to do that without having safety concerns or any other issues related to their disability. And I know that's like a sore spot for some people, but let me tell, like, I want people to tell me, like, how many times have you gotten a coffee these past few weeks? How many times have you gone out with friends and been social? That's what they're losing. It's basically like COVID. You're going to spend 30% more of your time indoors just not doing anything.
Withdrawn.
And not having really any interaction with anyone.
Yeah, and that's going to make your disability worse. It might not, like, physically affect it, but you wouldn't be happy if you were just in COVID all the time.
Yeah, I know. There's a lot of people that weren't happy in COVID at the time. Very much so. I think it's just a thing, I suppose. What I'm getting from you, Maddy, is that we all have the right to exist and to have that, so that we're able to do that on a...
Yeah, but sometimes existing isn't enough. We have
the
right to live decent lives.
Embrace it.
With
do
other
things,
people.
yeah.
Whether they're disabled or not, it's with other people because we're social creatures.
Interaction.
Yeah. Totally. I think that it's, you have thoughts, Tony? You've got lots of thoughts.
Oh, many different thoughts, but I'm afraid my short-term memory isn't exactly the best thing to rely on, so yeah. But yes, I in total agreement there. I believe that disabled or not, it's the whole mental and social interaction that keeps one's level of moral level upkeeping, healthy, so to speak, and that sort of thing is what keeps the social world revolving. Is that the way to put it?
Oh, the cogs turning.
Yeah, it keeps the cog turning. That's a good way to put it. Thanks, Bec.
No, okay, that's all good, because I feel like we all want to be loved and we all want to be part of something. And not having that opportunity to be out there and be involved, whether it's, I'll give an example for you, Tony, not being able to go to music lessons. That every week, that might make a big change for you if you can't get there.
Take that part out of my life, that'd be withdrawn.
And that's the thing too. It's not just affecting people with disabilities. It's affecting full-time carers. And carer burnout is a real thing. It's very dangerous to the person looking after the disabled person and very dangerous for the carer themselves. Like, that's these things that they don't understand.
And it's, I'm just hearing about this recently because I don't actually do NDIS plans, but people have been telling me they haven't got respite in their plan, which means...
So they can't escape, so to speak, for themselves?
So they can't go somewhere to give that carer some time off.
Yeah.
And also on the actual person in the NDIS, they can't practice being independent.
That's right.
And doing things for themselves.
Because they haven't existed with their full-time carer, they're just being spoon-fed the world.
Yeah, they're not getting that chance to get out there and have a go at doing things on their own. They might not go well, but they don't know unless they actually have a go at it.
Yeah, these are the little things that I feel like they are not considering, and they are just hoping that we kind of roll over and be grateful for whatever we get. And I'm sorry, but if they did that to your Medicare, there would be riots on the street. And the reason they have done this to us first is because they know we cannot fight back. It feels
Because we're
very
the weaker
targeted.
link, that's right.
It feels very targeted. It just does. You can't escape that feeling.
Also, in terms like that, targeted, we're clearly the minority compared to, say, Medicare, because Medicare is the whole country, whereas disability is, what, a fraction? Yeah, compared to Medicare.
Was it 5.5 million?
Yeah,
you said?
5.5 million from a study that came out, I think, in 2022.
Oh,
I can
so
only imagine.
So it's even more
yeah,
now.
yeah. And there are only like 70+ thousand people on the NDIS. So that's a very small portion.
Yeah. So a lot of people, like in my situation, well, we can't even get that. So we're having to work out how to do things and navigate around all those systems
That's very
without
compelling.
having that support.
Vox FM 106.9.
Okay, that was just ELO, the Electric Light Orchestra, with All Over the World. In 1980 it was released, and it actually was a Xanadu film feature. You know, we all know that film with Olivia Newton-John, and I believe you were saying something about it off air, weren't you, Bec?
Oh yeah, I don't know what the film's about entirely. I haven't seen it. Sorry to those people out there that have. But I know she does a lot of skating on roller skates. I'm not sure what it's about, but
yes.
I mean, neither do I, to be perfectly honest with you.
Well, honesty is the best policy.
No, but I would like to say thank you so much, Maddy, for coming and having a
very
chat.
welcome,
It's
Bec.
been an absolute pleasure.
Been very nice meeting you.
No, it's so refreshing to hear from somebody that's actually going through all this kind of stuff to tell us what's actually happening. We hear a lot of what people might think is happening, but it's really awesome to actually hear what is happening and how it can affect people.
Yeah, and all I want is just a bit of humanity at the end of the day, really. That's all I'm asking.
Not a big ask, I don't think.
No, you wouldn't think so.
No, but and it seems that way, but I
just
think that you're on the right track.
I want to say my little 2 cents worth now too. I can clearly see that you're wheelchair bound. Sorry, darling, but I went through a period myself where I was stuck to a wheelchair. Yeah, but they told me that I would never be able to walk again after I took that jet ski to the head, and yeah, I can relate. Trust me, don't worry. It's very almost an impossible feel that you'll get back to who you were.
It's a little bit different though about Tony.
Oh,
'cause
now it's different because I've gone
it's
through
something
all
that she's had a whole lot.
Yes,
So-
true shame.
I just want to stress, being disabled, it's not a depressing life. Like, disability does not, it can lead to depression, but it is not a depressing factor, right? What is the depressing factor is more or less how society reacts to it. Because nothing,
So true.
if very little, is accessible to many people.
I know. I'm an access freak, and I'll tell them if I go into a McDonald's or something, and I'm like, "Where's your ramp? Where's rail?" Because it's you want everybody to be able to be part of that, and I actually go out of my way to not go into a hamburger shop or something if I'm just confronted with a whole heap of stairs.
Yeah.
I'm like, well, you just lost my business. Sorry, I'll go somewhere else. But thank you so much again, and I'd love to have you on again and have a bit more of a chat to you as well. And I'll say good afternoon and thank you to everyone out there for listening. I hope you have a great week ahead of you.